Have you ever walked into a room and forgotten why you were there? Or struggled to remember a familiar name and wondered, is this just normal aging? It's a question that worries millions of older adults and their families every day. The truth is, dementia is not a normal part of getting older. While millions of seniors are living with dementia, many others never develop it at all. Knowing the early warning signs can make a real difference. Early diagnosis and treatment may help slow its progression, preserve independence, and give families valuable time to plan for the future. In today's video, we'll explore the early signs of dementia that you should never ignore, and what you can do if you notice them in yourself or someone you love. Sign 1: memory loss that disrupts daily life. Occasionally forgetting a name or misplacing your glasses happens to everyone. Memory changes can become a concern when they disrupt daily life. The Alzheimer's Association notes that a common early sign is forgetting recently learned information and repeatedly asking the same questions, often needing to rely on notes or family members for things people used to handle themselves. The Better Health Channel adds that early memory loss may include forgetting names and numbers you once remembered easily, misplacing objects, or struggling to recall new information. What makes this different from normal aging? In typical aging, you might occasionally forget a name but remember it later. With early dementia, a person may forget appointments, conversations, or events entirely, and the lapses become more frequent. They may repeat stories multiple times because they genuinely don't remember telling them. Memory loss like this disrupts work, hobbies, and social activities, and should prompt a conversation with a doctor. What you can do. If you or a loved one notices increasing forgetfulness, start documenting when it happens. Keep track of missed appointments, repeated questions, or times you needed help remembering something. Share this journal with a healthcare provider. Early detection allows doctors to rule out other causes, such as medication side effects or vitamin deficiencies. And, if dementia is present, start treatment plans that may help maintain brain function longer. Sign 2: difficulty planning or solving problems. Another early sign of dementia is struggling to plan and carry out familiar tasks that involve numbers or sequences. The Alzheimer's Association explains that people may have trouble following a familiar recipe or keeping track of monthly bills and may find it difficult to concentrate, taking much longer to do things than before. This isn't just about making occasional mistakes. It's about a noticeable decline in the ability to organize activities or solve everyday problems. For example, someone who always managed household finances may suddenly miss bill payments or struggle to balance a checkbook. A home cook might find a favorite recipe confusing, skipping steps, or adding ingredients out of order. They may have trouble following directions or planning a family outing. In normal aging, you might make occasional errors when managing finances or household bills, but repeated or growing difficulty in planning indicates it's time to get assessed. What you can do. Offer practical support while encouraging independence. Break down tasks into small steps, use calendars and bill organizers, and consider automatic bill payments. If you're the one experiencing this, ask a trusted family member to review financial statements together. If planning or problem-solving continues to worsen, speak with a healthcare professional. Early cognitive testing can identify issues and connect you with resources for managing finances and daily routines. Sign 3: trouble completing familiar tasks. People living with early dementia often find it hard to complete day-to-day tasks that once came naturally. According to the Alzheimer's Association, they may have trouble driving to a familiar location, organizing a grocery list, or remembering the rules of a favorite game. Losing your train of thought while doing household chores or forgetting the steps of a beloved hobby can be particularly frustrating for the person experiencing it. The difference between dementia and normal aging is consistency and impact. Occasionally needing help with a microwave settings or asking for assistance using the TV remote is normal. But regularly getting lost on the way to a familiar friend's house or forgetting how to play a card game you've enjoyed for decades is not. As dementia progresses, these issues may expand to include difficulty operating appliances, mismanaging medications, or failing to complete once routine work tasks. Left unchecked, trouble completing tasks can affect safety and independence. What you can do: watch for patterns of difficulty and help by creating checklists or step-by-step instructions for important tasks, such as cooking or taking medications. Encourage the use of assistive technologies, alarms, pill boxes, and GPS navigation systems. Discuss changes with a health professional. Occupational therapists can recommend strategies to adapt home environments and maintain skills longer. Sign 4: confusion with time or place. We all occasionally wake up and wonder what day it is. However, losing track of dates, seasons, and the passage of time can be an early sign of dementia. The Alzheimer's Association notes that people may forget where they are or how they got there and have trouble understanding something if it isn't happening immediately. They may think it's morning when it's evening or become disoriented in a place they've known for years. The Better Health Channel lists signs such as getting lost on the way to familiar places or being unsure how to get home. Normal aging might involve occasionally being unsure of the day of the week, but working it out later. In dementia, the confusion persists and causes anxiety. The person may wander or become frightened in once comfortable environments. What you can do: if someone gets lost or confused, stay calm and gently reorient them. Use visible clocks and calendars at home. Establish structured routines to anchor the day and minimize disorientation. Consider safety devices like wearable GPS trackers to help locate a loved one who might wander. Discuss these episodes with a doctor. They could also indicate other health issues such as infections or medication reactions. Sign 5: new problems with words in speaking or writing. Changes in language and communication are common early signs of dementia. People may have trouble following or joining conversations, stop in the middle of a conversation, and not know how to continue or repeat themselves. They might struggle with vocabulary, have trouble naming familiar objects, or use the wrong name, for example, calling a watch a hand clock. The Better Health Channel similarly notes that forgetting simple words, using the wrong word, or struggling to understand written text can be warning signs. Occasionally searching for the right word is normal. With dementia, difficulties occur more frequently and interfere with conversations, writing, and reading. The person may pause often, substitute unrelated words, or find themselves repeating a phrase because they have forgotten what they were saying. They may become frustrated, embarrassed, or withdraw from social activities to avoid the stress of speaking. What you can do: be patient and let them take time to express themselves. Reduce background noise and maintain eye contact when speaking. If they can't find a word, gently supply it rather than interrupting. Encourage communication through writing or drawing. Speech therapists can recommend exercises to maintain language skills. Seek medical advice if communication problems worsen, as language difficulties can also arise from stroke or hearing loss. Sign 6: misplacing things and poor judgment. Misplacing things occasionally is frustrating but common. In dementia, people put objects in unusual places and lose the ability to retrace their steps. They may leave their keys in the refrigerator or place a wallet in the bathroom, and then accuse others of stealing when they can't find the items. Misplacing items becomes more frequent and is accompanied by a genuine inability to go back and find them. Poor judgment and decision-making is another early sign. Individuals may show changes in judgment, such as handling money recklessly, falling for scams, or ignoring personal grooming. While anyone can make an occasional bad decision, frequent patterns of unsafe choices or neglect of hygiene can indicate cognitive decline. These changes often occur before more obvious memory problems, making them easy to overlook or rationalize. What you can do: help by creating designated places for essential items and labeling drawers or shelves. Simplify financial affairs by reducing the number of credit cards and setting up fraud alerts. Watch for uncharacteristic spending or changes in personal care. If misplacing items or poor judgment become persistent, seek a medical evaluation. Financial advisors and social workers can also provide guidance on safeguarding assets. Sign 7: Mood, personality, and motivation changes. Dementia can cause noticeable changes in mood or personality. The Alzheimer's Association notes that people may become confused, suspicious, depressed, fearful, or anxious, and may be easily upset at home, with friends, or in unfamiliar places. The Better Health Channel adds that sudden mood swings, becoming unusually withdrawn, or acting less inhibited can be early warning signs. These changes are often attributed to stress or fatigue, but may reflect underlying brain changes. A related sign is loss of initiative or motivation. The Better Health Channel explains that a growing lack of interest in activities, neglecting housework or personal hygiene, and socializing less can indicate dementia. Friends and family sometimes mistake this for depression or assume the person is just slowing down. However, when apathy and withdrawal are accompanied by other cognitive changes, they warrant attention. What you can do: observe patterns rather than isolated incidents. Encourage social interaction and physical activity, which can improve mood and cognitive function. If a loved one becomes withdrawn or apathetic, talk to them calmly about how they're feeling and suggest seeing a doctor together. Mental health conditions, such as depression, can mimic dementia, and early evaluation can differentiate them and provide treatment. What to do if you notice these signs? If you recognize one or more of these signs in yourself or someone you care about, don't ignore them. The Alzheimer's Association emphasizes that significant changes in memory, thinking, or behavior should be evaluated by a doctor. Early detection allows you to explore treatments that may ease symptoms and help maintain independence longer. It also gives you time to plan for the future, arrange support, and participate in clinical trials. Steps to track symptoms: keep a journal of what you notice, when it happens, how often, and how it affects daily life. Discuss with loved ones. Sometimes those around you notice changes before you do. Compare observations respectfully and without judgment. See a health professional. A general practitioner or neurologist can assess cognition, rule out reversible causes, and, if necessary, refer you to specialists. Seek support. Organizations like the Alzheimer's Association in the United States and Dementia Australia offer helplines, support groups, and educational resources. Dementia is a complex condition, but early recognition offers the best chance to slow its progression and plan for a meaningful life. Memory loss, difficulties with planning, trouble completing tasks, confusion with time or place, language problems, misplacing things, poor judgment, and changes in mood or motivation are not just normal parts of aging, they're potential warning signs. Paying attention to these changes and seeking medical guidance can make a profound difference for you or your loved ones. If you found this video helpful, please share it to raise awareness and subscribe for more health tips for life after 60. Remember, noticing small changes early and acting on them can protect independence, dignity, and quality of life.